The last project to listen to. After that, we will have a keynote speaker, and in the end, we will see the result on this year's competition. But the last project that is also from Peru, and that is from ESSALUD, and is about improving health information. So please, I really look forward to listen to your presentation. Warmly welcome.
Greetings, members of the jury and guests. I'm speaking to you on behalf of Seguro Social de Salud del Perú. We will present to you the project Health Information Improvement by implementing a specialized helpline with which we are participating in this international contest in agreement with the Sustainable Development Goal 3, SDG 3, Good Health and Well-Being. Due to the fast propagation of COVID-19 in China and other countries, the World Health Organization declared an international public health emergency. In Peru, the government declared a national public health emergency on March 11, 2020. It's because of this that ESSALUD implemented Línea 107 on March 18, 2020, together with a team of healthcare professionals to take care of all the incoming calls continuously, from Monday to Sunday, 24 hours a day, nationally, with the objective of providing orientation, prevention, and support, taking care of the population's need for information on healthcare and well-being. While Línea 107 was already taking care of the public's need for information regarding COVID-19, we identified through those same phone calls the need for information regarding other health-related problems, coming mainly from the after effects of the virus and the causes that put patients at risk. This is how the need for this systems improvement was planned, using the Continual Improvement Process, or PDCA, Plan, Do, Check, Act, cycle, since it provides a standardized approach and a philosophy that allows the members of the team to solve the problem, as well as to continuously improve the service, generating commitment and motivation, and reinforcing the sense of identity and loyalty to the institution. And with the help of a brainstorming process, the project started identifying critical issues. Some of these issues were the staff's limited training on health matters, insufficient personnel to cover the current increasing number of cases, insured patients' limited access to healthcare information, the agent's care soft skills, non-COVID related unattended medical urgencies, and unstandardized processes to respond to the insured patient's needs. Then, the prioritization matrix was elaborated to select the main issue, identifying the following as an improvement opportunity: the insured's limited access to receiving health-related information. Then, the Ishikawa diagram was elaborated to identify the causes of the problem, and through a prioritization matrix, the addressed root causes were selected, defining 3 specific objectives directed to reducing the causes of the prioritized routes: strengthening the personnel's healthcare competences, offering phone support for non-COVID urgencies, and implementing a phone line supported by healthcare professionals. Depending on each specific objective, an action plan focused on accomplishing them was established, thus eliminating the root causes. The implementation of Línea 107 allowed a significant reduction in expenses, besides helping to relieve the hospital services, allowing ESSALUD to optimize its human and financial resources, which was accomplished with the constant support of the senior management team. During the 2021 to 2023 period, a total of 4,157,798 calls were attended in the different options of the service. Making a comparative analysis with the cost of assistance in an ESSALUD Level 1 health center, the cost would reach a total of 136,602,934 soles. Subtracting an investment of 28,750,450 soles for hiring the personnel, we get an efficiency of 107,852,484 soles, which represents a 79% of savings in the estimated costs. The assessment of the effectiveness of the service has been continuous and based on the key performance indicators, KPIs, as the rate of abandoned calls, which has been reduced from 17.7% in 2022 to 1.7% in 2023, reaching the established goal given by the Quality and Humanization Management Department, which is lower than 5%. Ever since its creation on March 18, 2020 to December 31, 2023, Línea 107 has registered more than 5 million calls in all the different service options and an institutional saving of more than 100 million soles, that is $27 million. It has also considerably reduced the abandonment rate indicator, and the user satisfaction index has consistently surpassed 73.81%. This contact quality remains high, reinforcing the effectiveness of the service. Highlighting the fact that Línea 107 is constantly in development, during the current management, we have implemented new options, like Option 7, which offers information such as social programs for people with disabilities, senior citizens, and vulnerable populations. Option 8, which is the Donors Helpline. Option 9, which is ESSALUD's Oncology Helpline, as well as Option 5, which has become a rotating option that offers information regarding seasonal diseases. The project supply and demand effect shows that there is a capability to continue assisting more insured population without it requiring greater operation costs. If it is measured in terms of benefit cost, it undoubtedly benefits people directly, and the benefit for the institution is shown by strengthening its public health insurer role. Next, we will present to you the options that Línea 107 offered citizens during 2023. ESSALUD's Línea 107 has become a source of information, orientation, prevention, and support for both insured and uninsured patients, providing them with a variety of services depending on their needs through a nationwide free-of-charge 3-digit telephone line. This telephone line offers reliance and empathy in the face of situations that put patients' health at risk, with the help of a staff of specialized healthcare professionals with experience in telephone communication. Option 0. The nursing personnel provides information regarding the vaccine immunization schedules and centers, together with their opening hours and requirements as needed. Option 1. The personnel provides orientation regarding symptoms the patient may describe, which helps solve doubts about diseases. Also, the personnel provides orientation with prescribed medication, supporting understanding prescriptions, and more. Option 2. Pediatricians oversee danger signs to make sure patients go to the emergency room for temperature control, hydration, baby feeding, and more. Option 3. Licensed psychologists provide emotional support and orientation regarding doubts and questions about symptoms, emotion control, disorders in thought content, work problems, family problems, and more. Option 4. Licensed nutritionists provide orientation in eating habits changes and promotion of physical activity, which help prevent diseases. Option 5. In case a patient is suspected of having Guillain-Barré syndrome, dengue fever, and other emergent diseases due to seasonal weather changes and the El Niño Southern Oscillation, our doctors provide information to the insured patient regarding them and carrying out a triage. If necessary, the patient will be informed if they need to go to the hospital. Option 6. Social workers provide orientation in Spanish, Quechua, and Aymara when presented with case of violence against women and vulnerable family members, later providing information about the judicial proceeding and how to start it, as well as emotional support. ESSALUD reaffirms its commitment to keep working on providing a quality and timely service to the insured patients and the population in general.
La línea 107 se ha consolidado como una plataforma de contacto entre la población y ESSALUD, proporcionando acceso directo a información y orientación personalizada, de acuerdo siempre con las necesidades de cada usuario. A través de una atención oportuna, empática y de calidad, hemos logrado posicionarnos como un pilar fundamental en la cadena de valor del servicio público de salud, cumpliendo con nuestra misión de proteger y cuidar la salud de la población. Este esfuerzo refuerza el compromiso de salud en ofrecer servicios que no solo informen, sino que acompañen y apoyen a los ciudadanos en su bienestar integral.
Thank you very much for the presentation of the application. Just a quick message for Ivy Stream. Thomas, I'm receiving a message that there seem to be problems with the general connection, that they get a message of a video error or video player error. Okay, good. It's good to hear that. Sorry for that, but let's come back to the project and let's see if anybody has a question. If not, I'll start with a question. It mentioned in the application that there were no additional operating costs, and you even mentioned certain savings. But what the project is now, actually the service is now covering a lot more than it originally did, because it was originally only foreseen to give information on COVID, and now you're doing a lot more, so you probably need more people. But if you say that this brings savings, do you mean the overall process, including the fact that maybe because of the telephone support, you can avoid costs in other areas of healthcare?
Al referirnos al ahorro de costos, hablando de una comparación entre lo que cuesta el personal de la línea y lo que costaría la atención en un centro de salud.
Indeed, when we talk about cost savings, we are talking comparing to what the labor cost, what the recruitment cost would be related to the assistance in a healthcare facility or center.
Ese ahorro efectivamente se produce en la medida de que en nuestros establecimientos, en nuestros establecimientos de salud hay una serie de costos adicionales a considerar. En cambio, en la atención telefónica tenemos al profesional que ya está hablando directamente con el paciente sin necesidad de que exista pues el costo de infraestructura, de servicios adicionales, de temas de energía, agua, luz, guardianía, lo que es vigilancia, ¿no? Todos esos costos se ahorran en esta comunicación.
Okay. Yes, these savings that we are talking about, what does this mean? In our healthcare services, we have additional costs, but since the assistance is on the phone with this línea 107, with this telephone line, we have a direct communication between healthcare professionals and the patients. This way, the patient does not need to come to the healthcare facility, and this means a saving in infrastructure, additional services such as energy, water, electricity, safety personnel. All this means that we actually have important savings in costs, in additional costs.
Thank you. Jose Carlos.
Yes, Willie. Well, congratulations on your project. As we can see in your application, you are mainly focusing on goal number 3, the sustainable development goal of good health and well-being. You mentioned in the project and in the video that you were using now this service not only in Spanish, but also on 2 other more languages. You mentioned Quechua and Aymara.
Quechua y
We
Aymara.
have a metric on how that option has
Sobre cómo
helped
esta
to
opción
increase the good health and well-being of the population.
ayuda a llevar a cabo, alcanzar estos ODS con la población.
Efectivamente, el servicio, además de incrementar las opciones de información, también pasó a incorporar quechua y aymara, 2 de las lenguas fuera del castellano más habladas en Perú, sobre todo para los casos de violencia contra la mujer. En este caso, más o menos representa el 10% de los casos reportados de violencia contra la mujer en la línea 107.
Los casos de violencia representan el 10%.
No. Quechua y Aymara, 10% de todos los casos reportados.
Okay. So yes, indeed, we are not only increasing, or we have not only increased the information options in this line, but we added Quechua and Aymara, which are also the most spoken languages in Peru besides Spanish. And actually, the violence complaints or the violence related calls we receive, 10% of them are related to or are with Quechua and Aymara speakers. 10%.
Okay, thank you.
Yeah. So Narahari, but just a short question in view of time, please.
Pequeña pregunta. Porque no nos queda
This is service-related business. How your demand management system is working? Because demand is very uncertain. Some period you will have high demand.
La demanda,
Some
porque a
people,
veces demanda.
how your demand management system is working.
Nosotros usamos sistemas informáticos para controlar call centers, lo cual nos permite asignar la mayor cantidad de personas a los horarios que tienen mayor cantidad de demanda. Esto se ha traducido también en una reducción de la tasa de abandono o llamadas no contestadas del 17.7% en el 2022 a 1.7% en el 2023.
We actually work with computer systems to control our telephone centrals. We have more people working in the opening hours in which we receive most of the calls. And this has translated into a decrease in the abandonment rate regarding calls. We had an abandonment rate of 17.5 in 2022. And in 2023, our abandonment rate regarding calls was 1.7%.
Thank you.
Gracias.
Okay. Thank you very much again for the presentation and the project.